Hello guys, welcome back to my channel. So today I'm doing a video that has been quite highly requested because I thought that it could be helpful to some people. Today I'm doing a video on CBT therapy and EMDR treatment, which is two things that I am currently doing. Just quickly want to say, obviously I am no expert. If you are struggling, then please go and get a therapist or go to your GP or something, because this video is not going to fix your problems. This is just talking about my personal experience on EMDR and CBT. I've been doing CBT therapy for nearly a year now, and EMDR I've been doing for a few weeks, but it's very effective very quickly, and obviously I've learnt about it and I searched into it when it got brought up that I might be starting it at some point. The therapy I do is private therapy. The reason that I went private is actually because originally when I signed up for therapy I didn't get accepted to get therapy. There was such a long waiting list as well. It's just it's a long process to get therapy, and that's why even if you're scared to do it, I think it's best to sign up sooner than later, because one, you're hitting the nail on the head sooner, so that's going to be easier to help you, and also there's always a long waiting list, so it's going to take a while anyway. So I started off with CBT, as I say, around nearly a year ago now. I think I started in June of 2018 and it is now March of 2019. I'm going to quickly get the definition of CBT therapy up and just tell you a little bit about it from Google. So what CBT actually stands for is cognitive behavioural therapy. It says cognitive behavioural therapy is a psychosocial intervention that aims to improve mental health. CBT focuses on challenging and changing unhelpful cognitive distortions and behaviours. Wow, so many big words. Improving emotional regulation and the development of personal coping strategies that target solving current problems. So basically, long and short is it helps anxiety, and it helps if you have got quite bad kind of patterns with your anxiety, I find. So the most common things that CBT treats is anxiety and depression. I'm not 100% sure if it can treat other things too, but it has helped me with my derealization and stuff as well. So it kind of can. So the main two things CBT treats is depression and anxiety. I'm not 100% sure if it can treat other things too, but yeah, that's something you'll probably have to look into if you're suffering a different mental health condition that is not one of those two things. What I personally work on in CBT is my GAD, which is general anxiety disorder, my phobia, because I have emetophobia. I did work on insomnia and depersonalization very, very slightly and vaguely, and I also work a little bit on my derealization with my therapist. I find CBT very, very helpful. The main thing that CBT really is kind of what I just read, which is you get a therapist, you speak to the therapist about what you're struggling with your anxiety, you find the root issues to your anxiety, and then you find ways to challenge those issues, and eventually it helps you break them down and get better. I find it very helpful personally, and I've heard a lot of good things from other people about CBT before I started it, which encouraged me to start. So if you are thinking to start it, here is your encouragement that you definitely should, because it's really good. So what I do with my therapist usually, and have been from the start, is I actually have a therapy notebook, which is just a normal notebook. I just got it from the shop, and I originally started off by writing down when I was getting anxious and when I was having panic attacks and what triggered them if I knew, and things like that, my thoughts in general. My therapist then, from the notes, could crack down on some of the things that were my main root issues to my anxiety. It took a while to do this, it's not a quick process, but we found most of my main triggers. We still find little ones here and there now, but these were the main ones, and we cracked down on them. So for instance, I used to struggle with avoiding situations all the time when I was anxious. Either I wouldn't go full stop, or I would go, and then when I get there I get really anxious and have to go straight away, or sit in the car, or just leave the room to calm down. I will quickly say that there isn't really an issue with you going out and getting a breather when you're anxious, but you also obviously have to learn that even if you stay in the moment, the feeling will pass. Now, this is something that I kind of knew, but I'd never actually put it to the test, because I always ran as soon as I was anxious. I went into fight or flight. Is that the saying? And I'd quickly leave the room when I was anxious and get away from the situation. Instead, my therapist helped me to learn that I can stay in the moment and that the feeling will pass. And now, most of the time when I'm having a panic attack, I can stay in the moment and I don't have to leave the room. I like to. And that will always be a thing, because you want to avoid what's making you anxious. But I also learned that I don't have to. So them kind of thinking patterns, CBT can really help you crack down on, and yeah, I really recommend that you go and try it if you have got bad anxiety. EMDR. Let me yet again get the definition up. Okay, so EMDR, what it actually stands for is a big mouthful: eye movement, desensitization, and reprocessing. EMDR is a form of psychotherapy in which the person being treated is asked to recall distressing images whilst generating one type of bilateral sensory input, such as side-to-side eye movements or hand tapping. So basically the main thing EMDR treats is PTSD, post-traumatic stress disorder, but I've also found it to be a massive help on my anxiety, which may be because some of the root issues to my anxiety is past traumatic stress. Some of my post-traumatic stress is actually really small, and some people would be like, that's not even a big deal, and then some of it is really, really deep-rooted and crappy. But it helps with both things. It can help with simple PTSD and really deep-rooted PTSD. I'm going to try and explain what I know about EMDR because my therapist did explain it to me a while back when we were starting it, so I'm going to try and tell you what I remember her telling me. So your brainwave naturally is basically the kind of pattern of like, so it's kind of like, I don't know if it's actually left, right, but it's that kind of pattern of click, 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 click. When you have a traumatic memory that makes you panic, your brainwave just freezes. It completely stops, and it stops you from processing it. What EMDR does is basically, the two ways I know that you can do it, that's probably more, is you can either wear these like little headphones that have a click in each ear in the pattern that brainwave works, or you can have two little buzzers that you hold one in each hand and they buzz left, right, left, right. They are the ones that I personally choose to use, but obviously you can use whatever makes you comfortable. So before you start EMDR, or at least this was the way for me, is we wrote down different things that caused me post-traumatic stress. Some of them I didn't realise affected me as much as they did until we actually did the EMDR. So basically you'll have your little clicky ear things on, or you will hold the buzzers, or whatever other ways there are, and you'll be asked to recall those traumatic memories as vividly as you can possibly remember. You'll have your eyes shut and you will be remembering that crappy vivid image. I know it sounds really frightening, and I was really scared when I started it, but I can tell you it is bad, but it's not as bad as you think, and it's so freaking worth it for the outcome. Whilst you're thinking that image up, you'll have your eyes shut and you'll be vividly thinking it, and you'll have to stick with the image even if you're anxious, and these little buzzers or whatever will keep going in that left right pattern, which means your brainwave won't freeze up. That means that then you process the thing instead of it getting stuck and making you forever anxious when you think of it. Obviously, how hard it is depends on how much the image or the memory affects you. Some of the things you might work on, for instance, if you had a really bad panic attack at an event and you were in this massive crowd and it was so traumatic and it was so crappy, you might be asked to work on that. So you'll close your eyes, you'll have the buzzers, they'll be buzzing left, right, which by the way is not uncomfortable at all. It's literally just two little vibrations. And then whilst you're thinking of the image and these little buzzers are going, you'll be processing it better. It can make you panic in the moment if it was a panicky situation, but it's so freaking worth it because the outcome of it is literally incredible. I never thought for 1 second that it would be as effective as it has been. To this day, I don't know exactly how many sessions of it I've done. Probably, I'm guessing, maybe about 6 at this point. And my anxiety and just in general my PTSD and everything has improved so much. Some side effects you can get from it is feeling quite spacey, quite depressed. And I find one of the symptoms, which I thought was just me, but I searched it and it is quite a common symptom, is to get quite angry quite easily. They are common symptoms of EMDR, but I personally find that it's worth it, to be honest. So yeah, that is EMDR, what it does and how it works, and I find it very, very effective. I have been able to do a lot more events and a lot more things recently. I went back to a little school unit and started doing some more education because I hadn't done education in nearly 2 years because of my mental health. And I've been able to do all of these things because of EMDR and CBT. I'm definitely not going to sit here and say my anxiety is non-existent because it isn't. I still get anxious and I still have panic attacks, but I would say that I know how to manage it a lot better, thank you to my therapist. So yeah, EMDR treats PTSD, but I also find that it helps with my anxiety. So yeah, that is CBT and EMDR. If you have any questions about it that I didn't answer, then please feel free to DM me on Instagram. My username is Biddle Music. I'll put it on the screen here if you would like to DM me, or maybe here actually, because it will probably go on the buy flag well if it's white writing. I really hope that this video was helpful to you, and yeah, let me know if you've done CBT or EMDR or if you're planning to. If you are like trying to, you know, ask yourself, shall I do it, shall I not, then I would say definitely give it a go, because the worst thing that can happen is it doesn't work for you, and then you've tried it and you know that that's ticked off the list, something you've tried, and if it doesn't work for you, then there's so many other options out there. Anyway guys, thank you so much for watching this video, and I will see you all next time. Mwah! Goodbye!